Hi, I'm sitting in a hospital and today I'm going to talk to you about a topic which is really very relevant to any hospital or any place similar to this, even at your home. I'm not going to talk to you about patients. Today I'm going to talk to you about carers. When we talk about the patients, normally there is a feeling of awe or sympathy or empathy. But when we talk about the carers, we almost feel like there is a sense of washing our hands and saying, taking off our responsibility and saying, okay, there's always a carer involved. But have you ever thought about the feelings of the carers? How the life is behind the doors for them? When I used to work for a longer time with the carers, and I felt there is not only a potential loss of or a fear attached to the person they are caring for, but also there is a feeling of sense of loss for their own independence, their own lifestyle they used to have before starting taking the role of carer. When we talk about the carer role, normally we think about a sense of responsibility. While I think in my view, it should not be a sense of compulsion or but it should be a sense of choice which we should be giving to the carers. And I do get that there are some situations where even the carer or a patient, both of them, don't have any choice left behind. But then in that case, as human beings, that's our responsibility to step up and or a nation, as a nation, that we can support them. And I know in UK there are a lot of support available for the carers, but not every carer knows where where their support system is. So look out for those carers if they are struggling. um, Step up and be there for them. Just asking them how they are feeling can make a huge difference. Coming back from the carer role, I think there's something which is very close to my heart is not only carer, being a carer of a person who physically can struggle. I think sometimes there is a more stigma and difficulty attached to the patients who are suffering from mental health because um, a although we have some kind of awareness, especially where I'm based in UK, around the mental health, but there is still a lot of work need to be done around the mental health. People stay in the four doors, they struggle, they suffer, they don't tell anyone because the moment they tell other people, there's always be the sense of judgment there. And we are very quick to judge others, but we don't know what's going on for them in their lives. Mental health, again, diagnosis seems to be a little bit challenging than any physical illness. There's always be a sense of struggle being a carer, that where a carer stand in the patient's life, because can be a little bit unpredictable around their moods and everything. So again, as a nation, as a human being, what uh, our responsibility should be. I think the first one is that we need to approach if we need to see anyone struggle, and then refer them to the right support system, which is around you somewhere, which is around your the carer you are thinking about. Carers, to the carers, if you are a carer, my one advice would be, which is the most important, normally I always tell anyone who comes in the therapy with me, being a carer, that your role is almost like you, if a person is drowning, your one foot should be in the sea for them, but the other foot should be on the seashore so that you can be stable. Or it's almost like a aeroplane, the ruling, which is like, if you have any issue, first put the oxygen on your face and then put the oxygen mask to the other. So that's exactly, look after yourself, prioritize your needs as well. And when you're a carer, remember that your approach should be almost similar to where I'm at the moment, which is like a doctor or a nurse approach. Any patient they have, their goal is to make them feel better and on their 2 feet. That your approach should be. Your approach should be that one day you need to make them empowered, you need to make them resilient. And you can ask or challenge me and saying, Nazish, but my the person I'm caring for is completely bed bound. But even then, in the bed bound, if there is a small bit you can make a change, let them drink themselves, or if there is even less than that, even small tick can make not only make your life easy but also make them confident and resilient what they are doing. Look after yourself, and I'll see you in next video. Take care. Bye bye.